Moving forward.
Difference between maxillary and mandibular canine. I would suggest you to go through previous year's university question papers. And you can find this question repeatedly. Either the question can be asked as short note or long questions, so let's move on to our topic. Each tooth in upper maxillary and lower mandibular has its own morphology. In case of permanent canine, most of the morphological features are different. First, eruption. Mandibular canine erupts first at the age of 9 to 10 years, while the maxillary canine erupts at 10 to 12 years. Crown. Maxillary canine have a wider or larger crown with convex mesial and distal outlines, while the mandibular canine have less bulky crown which is long and narrow with relatively straight mesial and distal outlines. Also, the mesial and distal halves of maxillary crown are asymmetrical or are less symmetrical. But the mandibular canine show less symmetry on the mesial and distal halves. Root. Long roots are present in the maxillary canines, whereas the mandibular canine root is shorter by L or 2 mm on average than that of the maxillary canine, and its apical end is more sharply pointed. Cusp. Cusp is an occlusal or incisal eminence on a tooth. Canine teeth, otherwise known as cuspids, each possess a single cusp, while premolars, otherwise known as bicuspids, since they possess two cuspid. Cusp is sharp and is located labial to midline in maxillary canine, while in mandibular canine cusp is less sharp and lingual to midline. Slope. In mandibular canine, mesial slope of the cusp is much shorter than the distal slope. The distal cusp slopes more in an apical direction. So it is lingually placed, whereas in maxillary canine, both mesial and distal cusp slope show a tendency towards the concavity. Hence both slope are in straight line and the mesial slope is shorter than the distal slope. Ridges. The labial ridge, lingual ridge and marginal ridges, that is, mesial and distal marginal ridges, are more prominent in the maxillary canine, while in mandibular canine these ridges are less prominent. The lingual surface of the crown of the mandibular canine is flatter, simulating the lingual surfaces of mandibular incisors. Cingulum is more prominent. Lingual pits and groove are more common in maxillary canine, while less common in mandibular canine. Cingulum location. The cingulum is centrally located on maxillary canines. Cingulum is slightly offset to the distal and is located farther cervically on mandibular canines. Contact area. Contact areas are at different levels in maxillary canine and is more cervically located. In case of mandibular, nearly at same level and is more incisally placed.